called psoas major, and it begins with P. So this is the psoas major, and here this is the hip bone. This part is called ilium, and one muscle, as you can see coming down, is called iliacus. And they both will combine together to get inserted into the upper part of the femur, and as because they are so fused, they are sometimes called iliopsoas. But still, we can see them separately. Iliacus and psoas major. All right. Pectineus. Pectineus is the muscle basically we don't need to worry about much. All right. Pectineus is right here. Pectineus, very small muscle. If you forget, no one will kill you. All right. And then the sartorius. Don't forget this muscle. This is important. As you can see, one band-like muscle beginning from here, ending crossing the knee joint, ending in the tibia. This is the sartorius, one oblique muscle. And also you should know that this is the longest muscle of our body. Then comes the tensor fascia lata. Alright, this is the tensor fascia lata, one very small muscle incorporated with this big flat white sheet that's called iliotibial tract. So this iliotibial tract is basically keeping you upright, standing, balancing, or like keeping your knee joints stable. So it begins from the ilium, ends up in the tibia, so that's why it's called iliotibial tract. And this tensor fascia lata, small but very efficient muscle, it contracts and relaxes so that you can stabilize your upper part of the body, right? From the knee joint and above. Now about the adductor muscle. There are three adductor muscles over here: adductor longus, adductor magnus, and adductor brevis. All right. So this muscle is the adductor longus. All right, adductor longus. This muscle is the adductor longus muscle, and close to it there is another muscle that's called gracilis. Gracilis is the most medial muscle of your thigh. This is the gracilis, most medial muscle. Then comes the adductor longus. Adductor magnus and brevis, they are inside. I'm not going to ask you about them. Alright, just the adductor longus is over here. And there are three vastus muscles on the thigh. Okay, on the thigh. To see them, we have to remove this muscle. This one is called rectus femoris, because the muscles are somewhat straight, not shown here, but the muscle fibers are somewhat straight, so that's why this is called rectus femoris. And there are three vascuses. As you can see that one group of students, they had one exam to identify this muscle right here. And this muscle right here is called vastus medius. Alright, vastus intermedius. This muscle is called vastus intermedius. The muscle medial to this is called vastus medialis. The muscle lateral to this is the vastus lateralis. So three vascuses: medialis, intermedius, and lateralis. Alright, and this one is the rectus femoris. And all four muscles, three vastus and this one, they are called quadriceps femoris. Alright? Four, so quadriceps femoris. And what else you need to know? Let's go back and let's try to know the muscles over here. Let's try to know the muscles over here. Since you know this is the hip region, this is the gluteal region basically. The big muscle over here is called gluteus maximus. Alright, gluteus maximus. And this muscle over here is the gluteus medius. And if you remove this muscle, you can see another small muscle right here. That's the gluteus minimus. Alright, but I'm not going to ask you about the gluteus minimus. So gluteus maximus and gluteus medius we should know. Alright. In the thigh, we have got a couple of muscles over here, and there are three muscles. They are called hamstrings. Alright, they are called hamstrings. We have got one biceps over here. That one we call biceps brachii, because brachii means arm. We have got actually another biceps over here, but we will call it not biceps brachii. We will call it biceps femoris, because femoris is the thigh. So this one is the biceps femoris on the lateral side. You see that they are more or less looking like the same, but remember lateral and medial. Biceps femoris is always on the lateral side. So this is the biceps femoris. On the medial side, we basically have two muscles. One is called semi-membranosus, another one is called semi-tendinosus. Why? Because one muscle has got long tendon, that's why it's called semi-tendinosus. One muscle has got more flesh, that is called semi-membranosus. So from this, you can actually see which muscle is having long or bigger tendon. Definitely this one, the topmost one, alright? So this is called semi-tendinosus, and this one is called semi-membranosus, alright? Semi-membranosus. Okay, and they are on the medial side. M for M, you can also remember like that. Now let's go down to the leg. Let's try to look at the leg from the back. Here you can see that two muscle heads are there, going and reaching the knee joint. These are called gastrocnemius, two heads of gastrocnemius muscle. And if you remove the gastrocnemius, as you can see that another group of students, they have the exam on this muscle. This muscle is called soleus. There is a very small muscle over there that's called plantaris, but most probably I am not going to ask you about this muscle. However, this is the plantaris and this is the soleus, and as you can see that two heads, these are called gastrocnemius. Alright? Gastrocnemius. Soleus, gastrocnemius, plantaris, all three muscles fuse together to form one common tendon. That's called tendocalcaneus or tendoachilles. Alright, this is tendocalcaneus or tendoachilles. Alright. Now, front of the leg. This bone is tibia, right? No doubt. This bone is tibia, and next to tibia there is a muscle. In the anterior aspect, that's called tibialis anterior. Alright? Tibialis anterior. This muscle is called tibialis anterior. And there is another muscle right here, as you can see, right next to it, and having many tendons reaching the digits, reaching the toes. So, this muscle is called extensor digitorum longus, like the one we just heard before in the upper limb. It is got the same name, alright? It got the same name. And here, on the lateral aspect, we basically are having two muscles. One is called fibularis longus, another one is called fibularis brevis. So this muscle on the top, as you can see that this muscle begins from here and ends up, actually not ends up, it goes below the sole of the foot, and this is called fibularis longus. Because fibula is on the lateral side, and this muscle is from the fibula, so that's why it's called fibularis longus. We have got another muscle, fibularis brevis, smaller muscle, as you know, the longus and brevis should be paired. This is the fibularis brevis, but I'm not going to ask you about that, alright? And similarly, retinaculum, extensor retinaculum. In the leg, we have got basically two retinaculums, superior and inferior retinaculum. They are like a fork of Y. So superior one is on the top, inferior one is on the bottom, and you can see the retinaculum extended from tibia to the ulna. Alright? Anything else? Alright? So there are about 700 muscles in your body, and we just try to learn maybe less than 50 muscles, right? So that's actually good. If you know these 50 muscles,